COVID-19 is a new disease. Many things are still unknown. Scientists, researchers, healthcare workers and others are working together to better understand the virus, how it spreads, and how we can protect ourselves, our loved ones and everyone else. But science does not stop. It changes and evolves over time. It has an enormous influence on our daily lives. Every day we discover, experiment and understand new things. And even though changes may seem confusing, they are for our good. They show that we are learning and finding better ways to tackle the virus that causes COVID-19. This pandemic is challenging. It is unprecedented. And while science continues to evolve, finding new and better solutions, we need to come together and use the tools and knowledge we currently have. Guidance and advice will still change over time, so be open to changes, new facts and recommendations. Remain flexible, show your resilience. Be the change. Let's all prevent the spread of COVID-19.
Okay, Assalamualaikum and a very good morning everyone. Welcome to our educational talk which is focusing on COVID-19 issues. First, let me introduce myself. I'm teacher Aini and I'll be responsible for hosting this talk today. Okay, first and foremost, I would like to thank you everyone in this live streaming for allocating your Sunday morning with us and attending this educational talk about COVID-19 issues. On behalf of HIP committee and all those involved in organizing this program, I would like to say thank you very much. So guys, are you ready for this talk? All right, so I hope everyone will get a clear information about these COVID issues after this talk. Okay, first of all, I'm glad to welcome our respected headmistress of SK Taman Selasih, Puan Rozana, our senior assistant, Puan Suryani, Puan Marzia, and also Puan Aisyah, teachers, parents, and our beloved students of SK Taman Selasih GOMBAK. And now I'm glad to welcome our special guest here from Royal College of Surgeons in Ireland, medical graduate Dr. Ilia Jauharis. Good morning, Doctor, our speaker, who will present these COVID-19 issues. Good morning, Doctor. Assalamualaikum.
Hi, good morning, Waalaikum Salam. Hi, everyone. Thank you so much for watching today.
Okay, welcome to the world of SK Taman Selasih Primary School, Doctor. So before we go into this further, can you introduce yourself to us, Doctor?
All right, so hi, everyone. Good morning. Assalamualaikum. My name is Dr. Ilia. I'm a medical graduate from the Royal College of Surgeons in Ireland. Currently, I'm waiting for my housemanship position to start to work for the KKM. And today I'll be talking to you guys about COVID, and I hope that I'll be able to give you guys clear information and you'll learn something today.
Okay, thank you, Doctor. So as we know, COVID-19 issues is in our community right now. All of us hope we can have a good insight about this pandemic issue after this meaningful talk. If any one of you during this live streaming have any question to ask Dr. Ilia, you may drop your questions in the comment box below. So I will try to read the question after the talk and during the Q&A session. So Dr. Ilia, without any longer, so can we go into the topic now?
All right, yeah, I will share my screen and start the presentation.
All right, okay.
Okay, is that clear for everyone? Can everybody see what I'm presenting?
Okay, it's clear, Doctor.
Okay, all right, so let's begin. So hi everyone, like I said, my name is Dr. Ilia, and today I want to talk to you guys about the COVID infection and why it's so important for us to take the vaccine in order to stop this horrible disease. All right, so first, let's talk about what exactly COVID-19 is. So can anyone tell me what COVID-19 is? Is it an animal, like a type of insect or something? Does anyone know?
Okay, does anyone know about the COVID infections? Okay.
Okay, so COVID it's actually a virus. And what a virus is it's a tiny organism that can enter living things and make you really, really sick. So there's actually millions of different viruses, and they all behave in a different way, and they all have different shapes. So even like the common flu that we get, it's a type of virus. And the coronavirus is a type of virus. The COVID-19 virus that we're dealing with now is a type of coronavirus. So it belongs in the family of coronavirus. So we've actually come into contact with coronavirus before. Previously, we've had to deal with SARS and MERS viruses. You guys have probably heard of that. Those are types of coronaviruses. So because of this, scientists actually are quite familiar with how coronaviruses behave. Okay, so how exactly does it make you sick? So viruses, they only have one goal, and this goal is to make more copies of itself. Viruses can only make more copies of itself when it's inside our body. So the only way for it to make you sick is by filling your body with many, many copies of itself and taking over your whole body. So the way that COVID enters your body is through these small particles, and we call those aerosols or droplets. These aerosols or droplets are the liquid that gets released when when sick people cough, or when they're sneezing, when they're spitting, or when they're talking. So a healthy person, if they come into contact with someone that's sick, and the person that's sick coughs or sneezes or spits, the person that's healthy will breathe in all these little liquid, and these particles have a virus in them. So because of that, when you breathe in, the virus can then travel down and enter into your lungs. Once it enters your lungs, this is when it will make more copies of itself, and so it will fill up your whole body with virus, and it can spread everywhere in your body, and this is why you feel very sick. Okay, so what actually happens when you get COVID? So some of the common symptoms that people get when they get COVID-19 would be fever, a dry cough, trouble breathing, tiredness. They won't be able to taste or smell, and they may have a headache. So how sick a person gets all depends on how healthy a person is. So for example, someone is very young and has no other sicknesses, they'll be able to quickly recover from COVID, and they won't need to go to hospital. But someone who's old or has other diseases, they will get a very serious disease, and they'll need to go to hospital. So as you can see here, 85% of people who get COVID will have a very mild infection, and they won't need to go to hospital at all, and they'll probably recover in about 1 to 2 weeks. 10% of these 85% of people, they will not need to go to hospital, but their symptoms will last for more than 4 weeks. And for 15% of people who do get COVID, they will actually get a very serious infection and need to be hospitalized. So they need to go and see a doctor and stay in the hospital, and their symptoms will usually last for more than 8 weeks.
Oh, it's so long, huh?
Yeah. So,
8 weeks, huh?
because of that, we want to find ways to prevent the infection. So I'm sure everybody knows how to prevent it by now, but one of the ways is to wear a face mask, we want to social distance, wash our hands very often, and also disinfect and clean any surfaces that we usually touch or that a lot of people touch. And the reason why we want to do this is because we want to make sure that we don't come into contact with any of those aerosols or droplets that I was talking about from infected people. So if we touch any surfaces, we won't get sick and come into contact with those aerosols. All right, so now that we've talked about the COVID-19 infection, let's focus on our main topic today, which is about vaccines. So what is a vaccine? A vaccine is a type of medicine that we use to train our body's immune system to fight against a disease that it's never come into contact with before. Okay, so you can think of a vaccine like your body's armor. So, okay, if you're going into a war and you have to fight bad guys, you'll want to have some protection, right? You want weapons and you want to have a shield and have armor so that with all this, your chances of winning are a lot higher. You're more likely to win, right? So vaccines, they work in the same way. They are our body's armor. They help to protect us from the viruses and the bacteria that will try to infect us. Vaccines, they help teach our bodies to recognize these germs and fight them away so that we won't get sick from it in the future. I'm sure that everybody has gotten vaccines before, even from the moment that we're born, we've already been given vaccines. And since then, we get vaccines, children especially get vaccines quite often. Okay, so what actually happens to our bodies when we get sick with an infection? Well, during an infection, your body will make these things called antibodies. And antibodies are little proteins that will attack and kill these bacteria and viruses. So antibodies are like the superheroes in our body that help to kill all the bad germs. And after your antibodies have killed all these germs and you don't have your infection anymore, they will actually stay inside your body. And by staying inside your body, it will help your immune system to remember how it was able to kill off the infection before. So that's why if after this you ever get exposed to the disease again, your body will know exactly how to destroy and attack it, and you won't get sick from it. So there is actually two ways that we make antibodies. The first is by getting a real infection. So this means that you have to be exposed to someone that's sick, and you yourself have to get sick too. And the second is by getting a vaccine. So because there's two ways to get antibodies, a lot of people wonder, why don't I just get sick from the infection? So why don't I just get sick from COVID and I'll get the antibodies? And the reason why we don't want to do this is because it's not very safe. If you were to get a real infection, so if you were to get COVID, we don't know how our bodies will react to the virus. So like we said before, different people all react differently to the virus. And this all depends on how healthy you are, right? So we don't want to risk getting sick and getting the infection and becoming very, very sick from it, because some of the infection can be very deadly and it can result in a lot of people dying from it. So with vaccines, scientists have already researched and studied the medicine to make sure that whatever they're giving to you is going to be as safe as possible. So a lot of people may wonder, do I really need to be vaccinated? And the answer is yes. The two main reasons is because not only does it help you to protect your body from diseases it's never encountered before, but it will also kill off deadly diseases that would otherwise make many people become very sick and even die. So a lot of people want to know whether we can actually get rid of COVID with this vaccine. And based on our history with vaccines, we're hoping that COVID can actually be completely destroyed with vaccines. So here's just some examples of diseases that we were able to control using vaccines. So there's smallpox and polio. I'm sure that probably your parents or some of the teachers may have heard of smallpox and polio, but I'm not sure that some of the kids have. Because we don't have these diseases anymore. And the reason we don't have the diseases anymore is because of vaccines. So for smallpox, in the 20th century, actually, it killed more than 500 million people. And because through vaccines, the WHO, which is the World Health Organization, was able to declare that everywhere in the world, we don't have smallpox anymore as of 1980. So with polio as well, Before we were able to get, when the polio vaccine was first made, 1,000 children would become paralyzed every single day because of the disease. But since then, we've actually been able to decrease the number of people with polio by 99%. So as you can see, like in these two cases, vaccines really, really help to make sure that people don't get sick from these diseases, from these very deadly diseases anymore. So with the right vaccine, scientists are hoping that we can get another success story just like this with COVID. So do you guys think that getting vaccinated is important?
Yes.
Yeah. Because the main reason we want to get vaccinated actually is because we want to achieve something called herd immunity. So what herd immunity is it's the idea that a lot of people have to become immune to a disease for it to be difficult for the germs to live and spread the infection in a community. So let's take a look at this picture. The people in red are the people that are infected, okay? So if these infected people cough or sneeze or talk and spread the virus to the people around them, these people, if you can see, there's a blue line around them. That means that they are immune. They have already taken the vaccine. So because they're immune, even if this person spreads the virus to them, they can't get sick from it, okay? And so because the virus can't go to these people, that means that these people then can't spread the virus to all these other old people and the babies who can't get the vaccine. So these people here, they haven't gotten any immunity towards the disease, so they're not protected from the disease. But because most of the people in their community are protected, they become protected too. All right. So because of this, a lot of people actually wonder, why can't we just get herd immunity by getting natural infection? So just make sure that everybody in the community has gotten COVID before and has gotten sick with it before, and they get the antibodies, then we can be sure that we get herd immunity. Well, because if we achieve herd immunity through a natural infection, this would mean that many, many people would need to be sick, and some of those people will even die before we can actually make sure that everybody is immune. So it's very risky to achieve herd immunity in that way. Okay. And like I said before, herd immunity is important because we are protecting the people that can't be vaccinated. And these people would be people that are too sick to be vaccinated, or people that can't get the vaccine because they don't have access to it.
Yeah, correct.
Okay, so now that we've talked about vaccines in general, let's move on to talking about the COVID-19 vaccine. So it's been a little over a year now that we've come into contact with COVID-19, and since then, we've actually come a very, very long way from finding a cure for this disease. Currently, there's actually 90 different vaccines that are being tested on humans already. And I'm sure that a lot of people are wondering, why were the scientists able to come up with a COVID vaccine so quickly? And a lot of people are actually worried about this because they don't know whether it's safe, was everything too rushed? Why did the scientists make the vaccine so quickly? Did they research it and study it properly? Well, the reason that they were able to do this, they were able to make the vaccine very quickly, is because, like I said, one of the reasons is because, like I said before, they've actually come into contact with coronaviruses before, right? Like the SARS and the MERS viruses. So because of this, they already know how the virus is going to behave and how they can kill the virus. So another reason is also because with the COVID vaccine, they've actually used new technology to make the vaccine. So I'm not sure if you guys have heard, but some of the vaccines use this new technology called mRNA vaccine. And with this new technology, it requires a lot less steps, and it's a simpler and faster way to make vaccines. So those are just some of the ways that the scientists were able to make vaccines quite quickly. But don't worry, making a vaccine fast doesn't mean that it's unsafe. I can assure you that all the vaccines that are being given out to people now, they've had to go through many steps to make sure that they are as safe and as effective as possible. Okay, so because COVID is still quite a new disease and the virus is continuously changing, so it's always changing, and because of that, scientists are still having to study the virus and make some changes to the vaccine. So this is actually one of the reasons why, even if we do get the COVID vaccine, we may still get sick from COVID. So we may still get infected by COVID. And another reason is because it takes a few weeks for us to make these antibodies. So in those few weeks that your body is still building up the protection, you may get infected with COVID during this time. So that's why it's very important for you that even if you've gotten your 2 doses of your vaccine, you still need to wear your mask and keep social distance yourself with people and wash your hands and everything. Another reason is also because, like I said, different people react differently to the infection. So some people's immune system, it may not be very strong. So people that have like other illnesses or older or very young people. So because of this, they may not make enough antibodies to fight the infection completely. Yeah, so, but don't worry, this shouldn't stop you from getting the vaccine. You shouldn't be worried about getting the vaccine because even if you get vaccinated and you do get COVID in the future, the infection that you get will be a lot less serious and you won't get as sick. So for example, if you don't get vaccinated, the chances of you having to be hospitalized and to stay in the ward will be a lot higher than if you get vaccinated. So if you get vaccinated, your infection will probably, you won't even realize that you're sick. You'll feel sick just like you would if you get a flu sickness or something like that. Okay. Now let's talk about the COVID vaccines that we have in Malaysia. So currently, Malaysia, it has and will be getting 5 different vaccines. These vaccines are the Pfizer vaccine, which is from the US, CanSinoBio, and Sinovac, which is from China, and then AstraZeneca from the UK, and the Sputnik 5 vaccine, which is from Russia. So, yep, and the government is making sure, and they're talking with a lot more countries and a lot more companies to make sure that we get enough vaccines for the whole population. Okay, so one of the big things that everybody is worried about when they take any medicine is, will I get side effects from this? And I'm sure that you guys have all heard of some side effects that people have gotten from the vaccine. Well, I'm here to tell you that it's actually normal for you to have side effects. We actually expect you to have side effects. It's good that you get side effects because this shows that your immune system is working, is doing what it's supposed to, and it's fighting off the infection. So the common side effects that you may feel would be like any injections that you've gotten before this, you may feel pain, redness, and you may get some swelling at the area that you've been injected at. And then you may also get a headache, some muscle and joint pain, a fever, tiredness, and chills, and maybe even diarrhea. But although you may feel sick for a few days, all of these symptoms should go away by itself in a few days. So most of the time, people don't need to be don't need to go see a doctor or be hospitalized because of these symptoms. But some of the things that you can do to make sure that you're not as affected by these symptoms is to take a Panadol. If you're having a fever or if you're having body aches, just take a Panadol. And also drink a lot of water and get a lot of rest. Okay, so when exactly can I get my vaccine? So the government has planned for the vaccine to be given out in 3 phases. So the first phase would be for the frontliners. We are actually almost complete with the first phase now. The second is for the high-risk people, so like the very old people and people who have other illnesses and people who are disabled. And we have actually started this second phase. We're in the second phase right now, and we started on April 19th. Yep. And finally, the third phase is for everyone else that's healthy, if they're 18 years old or older. So I'm sure all of the students watching this right now are looking at this chart and realizing that, hey, there's none of the phases include children. Well, this is because actually right now, unfortunately, none of the vaccines have been approved for use for children. So that means that this is because none of the vaccines have been tested on children. So we don't know the effect that it will have on children yet and whether it's safe for them or not. So that's why we can't give vaccines to children just yet. But don't worry, because scientists are already working very hard to make sure that the vaccines for kids get made. And actually, they said that there may be a vaccine for kids as early as the end of 2021. So it doesn't mean that you won't get the vaccine ever. It just means that you're not going to get the vaccine right now. Okay? But this doesn't mean that you guys don't have a very important role in making sure that we defeat COVID. So your job now is to make sure that all the adults that you know, your parents, your grandparents, your aunties, uncles, all register for the vaccine and they go and take it, okay? So, and you guys also need to make sure that you've received all your other injections. So all the injections that you're supposed to get in school, you've already gotten them. And if we get most of the adults in our society vaccinated, it will mean that all the children will be protected too, okay? So I hope that all your parents have registered for the vaccine. If they haven't, you can tell them that there's two ways to register for the vaccine. So the first way is through the My Sejahtera app. So as you can see here, this is what you will see, and this is what the notification you'll get if you've been vaccinated. And the other way is by using the vaccine COVID website that the government has made. And this is what that website looks like. So make sure you tell your families about these two ways to register, okay? And that's it from me. I hope that today I was able to teach you guys something about COVID and about the vaccine, and that with this information now, you guys can go share this information with your friends and your family and make sure that everybody gets the vaccine. Thank you very much.
All right. Thank you very much, Dr. Ilia. So I hope all of you enjoy this amazing presentation from Dr. Ilia. So as we know from the presentation, we know that the virus tends to make copy of itself. So that's why it's become so contagious among us. So if we touch surfaces, like Dr. said, we won't get sick unless we do the prevention that mentioned by the doctor just now. So why do we need to be infected if we can prevent it from infect us? Right? So together we should build the herd immunity to help our beloved people around us who still cannot be vaccinated. So now Dr. Ilia will answer some questions that were sent to us during the presentation. So the first question is, okay, if you still have any question, you still can drop the questions in the comment bar below. So I will read it later. So the first question is from Muhammad Azam just now. Why people, the first question is from Muhammad Shamir right now. I will read. I worry now so many vaccines, lots of vaccines choices that doctor said just now. Which one should I get? Okay. So doctor.
Okay. So yeah, it's true. There's many different vaccines, and a lot of people aren't sure about which vaccine to take, and if they get a certain vaccine, whether it will be as effective as other vaccines. So I'll try to put up, sorry, I have an image of a table showing the different vaccines and how they compare with each other. So I'll just show you that now.
Is it true that some of the vaccine have different side effects from which this
Yeah,
vaccine?
yeah, it's true. Different vaccines have different side effects, but overall, the side effects that they have are the ones that I've showed you just now. Those are the common side effects that all of the vaccines would probably have. Okay, so let me just share my screen again.
So maybe they get confused because nowadays in the TVs or in the news they are keep mentioning the AstraZeneca and whatsoever vaccine that have been mentioned by the government. So it may be confuse them, right?
Yeah, true. Okay, so this is just a table showing all the different vaccines and how they compare with each other. So, okay, don't get overwhelmed by this table. I know it's a lot and it's hard to take it all in, but I'll show you exactly what you need to look at in this. Okay, so what we want to look at is these are all the different vaccines. And if you can see here, Pfizer vaccine is the only mRNA vaccine. So like I said, that is the new technology. That's the new vaccine that has been made specifically for the COVID virus. All the other vaccines are DNA vaccines. So these are the type of vaccines that we've gotten before, like our BCG and our measles vaccine and stuff. It's all using DNA technology.
Okay.
Another thing that we want to look at is the efficacy. So with the efficacy, efficacy means the number in a controlled setting. So like in a lab, okay? In a lab, when the scientists are doing research, how effective is this virus in a controlled setting? So that means that in a setting where everybody is healthy and everybody is has no other illnesses, how effective the vaccine will be for them. So for Pfizer, it's 95% effective, and for AstraZeneca, 90% effective. For Sinovac, which is the China vaccine, it's about over 50% effective. For CanSino Bio, which is also the China vaccine, is 74.8% effective. And the Russia vaccine, Sputnik 5, is 91.4% effective. And also another thing that we should look at is the regimen. So how do we get these vaccines? So all of the vaccines actually require 2 doses, except for the CanSino Bio vaccine. So the government has said that the CanSino Bio vaccine is actually a good vaccine to give to places where it's more rural, like some of the kampong that, you know, we aren't able to store the vaccine in a fridge or something because we can't, or people that can't come for a second dose, CanSino Bio is a good option for them.
Yeah.
So this is just showing you all the differences between the vaccines. And yeah, I hope that I was able to explain that to you in a way that you understand. But yeah, like I said before, the whole effectiveness versus efficacy thing, you shouldn't focus too much on that, because efficacy is how a vaccine works in a controlled environment, like I said. But effectiveness is how it's going to perform in the real world. So we actually don't know how it's going to perform in the real world yet. We don't know how it's going to play in our society, but scientists are still looking into that because the vaccines have just started to be given out, right? So if you see that, if you get a vaccine and you see that, oh, it's not as effective as another vaccine, that doesn't mean that later on it's not going to be as effective, because all these numbers, the 95%, the 71.4% and stuff, is all talking about how it worked, how it reacted in a lab situation. So we don't know how it's going to react in our world right now.
Yeah, that's correct. Because effectiveness is different in different people, am I right? Because you said the healthy people will get the different effective and then etc. Am I right? So we shouldn't compare the efficacy among these vaccines. Right.
Yeah,
so
true.
second question is from Asmiza Muhammad. Okay, if I am diabetic patient and had heart problem and to experience some diabetics medication, can I get the vaccine? Is it safe for me?
Okay, so first of all, anyone with any other illnesses, So in your case, it's having diabetes and heart problems. You are at high risk of getting COVID. And if you do get COVID, you are at high risk of getting a very serious infection and you may need to be hospitalized. So that's why the government is making sure that everyone that has other illnesses gets priority and is put in that second phase. So it is very, very, very recommended that anyone with any other illnesses does get the COVID vaccine. In relation to what you were asking about your medication, so most of the medication can be continued, but because you should talk to your regular doctor, the doctor that you go to for your regular follow-ups about this, just to make sure that it's safe for you to continue the medication, or if they say that you should stop the medication, it's safe for you to stop your medication for a short time. So just talk to your regular doctor about this.
All right. So there are lots of questions coming in. So the third one is when a person, like you said, when a person receives the vaccine, the antibody react different towards each other. Am I right? So when Rosanna asked, can you please advise why does the antibody difference with other person?
Okay, so actually the antibody is not different. The antibody that you get from a real natural infection and the antibody that you get from vaccines is the same. The only difference is how safe it is. So with a vaccine, it's safe because it's been studied. They've already done a lot of research on it and they realize that it doesn't cause many, many bad effects to the people receiving it. But with a natural infection, you don't know how you're going to react to that, whether your body can handle the infection. So if you get the antibodies from a natural infection, you can get the antibodies, but before that, you may get very, very sick and have to be hospitalized and need a lot of different medication for you to get better. So don't worry, don't think that if I get the vaccine, my antibodies won't be as strong as if I get a natural infection. That's not true, because overall, you're getting exposed to the same thing.
Yeah, like I said before, like I summarized before, why we need to be infected if we can prevent it, right? So, right. So the fourth question is it true that those vaccinated can still be infected? Okay, so we have learned, we have heard about the vaccinated person who get the COVID-19, right? All right. Okay, so.
Yeah, so like I said just now, you can actually still get infected if you get the vaccine. And this is because of a few reasons. So one of the reasons is because, like we know now, the virus is actually changing. There's many variants of it now. And so because of that, the scientists are still studying the virus to see what changes need to be made with the vaccine to make sure that it can kill this virus. Another reason is also because for you to make antibodies, it isn't immediate. You don't get injected and immediately you have antibodies. It takes a few weeks for your body to build up this protection. So in those few weeks, if you don't take care and don't wear a mask and you don't wash your hands and stuff anymore, you can still get infected by it. And also different people will make different amount of antibodies to it. So if you're very, very sick, you have a lot of other illnesses, or if you're very old or very young, you may not make enough antibodies to fight the infection. So that's why you still get people that get the COVID infection after they've gotten vaccinated. But the infection that they get, if they get vaccinated, is a lot less severe. They won't need to be hospitalized. They may just get like a bit of body ache or some fever, but it won't be severe.
Yeah. So like you say, it takes a few weeks to react towards the body. Am I right? So I just read just now. There's a student asked, my mom is still breastfeeding my sister or brother. So can she get vaccine, or is it safe for her mother or his mother?
Okay, so right now, the reason that the government doesn't want to give vaccines to people that are pregnant or people that are breastfeeding is not because, they found that it's not safe for the mother or the baby, but it's actually because there's not been research about it. So in all the time that the scientists have researched about all these different vaccines, they haven't included any pregnant women or breastfeeding women in their study. So because of that, we don't know exactly how these mothers and their babies will react to the vaccine. But based on all previous vaccines before, it's safe to give to breastfeeding women. But it's just in this case, we don't know how breastfeeding women will react to it. So it's not that they can't be vaccinated right now. It's just maybe they have to wait a little longer, just like the children. Wait for more research to be done for you to be sure that it's 100% safe.
Okay, but after all, vaccine program is a volunteer from the people itself, right? The government doesn't force us to take the vaccine, and we had some of the frontliners who is still breastfeeding taking the vaccine for their prevention, right? Am I right? So it doesn't mean it doesn't say for the breastfeeding or pregnant lady, but it not being researched by the lab itself, right? Am I right? But they are doing the research right now for the children and the breastfeeding.
Yeah,
Right.
they've already started research for all these different needs to make sure that we get a vaccine early on for all these people.
Okay, the last question is how about the effectiveness of the new vaccine? And this is the vaccine that has been lingering in the news nowadays, AstraZeneca, am I right? The politicians and the government also keep on questioning about this vaccine. Can you explain more about this, Doctor?
Yeah, so I know that this is the hot topic now with everybody about the AstraZeneca vaccine. And actually, today at 12 p.m., you can start registering for it, right? You can volunteer and you can register for it. So I know a lot of people want to know about the AstraZeneca vaccine. And if we can see from the...
Does it true that they prioritize for the 60 years old people to get the AstraZeneca? Am I right? I heard from the news they try to volunteer. People who volunteer should be around that age lah, because they ask them to volunteer, am I right?
Yeah. So as you can see from this chart that I showed you just now, for AstraZeneca, it's 90% has a 90% efficacy rate. It's a DNA vaccine, so it's not using the new technology with the mRNA. But I think what's more important to talk about right now is all the side effects that people are talking about right now. So the blood clots and all that. So I just want to show you guys some charts that I saw. This is talking about how likely it is for you to get these serious side effects, so for you to get these blood clots and everything from the AstraZeneca vaccine in comparison to other risks. So in 1 million people, and they've divided this into 25-year-olds versus 55-year-olds, okay? So for you to get a very serious side effect from the vaccine, for a 25-year-old, it's about 11 people in 1 million. And for a 55-year-old, it's only 4 in 1 million. The chances of you dying from coronavirus is a lot higher. So for 25-year-olds, it's 23 in a million, and for 55-year-olds, it's 800 in a million. And as you can see, the chances of you dying from an accident or a car accident or being hit by lightning, it's a lot higher than actually getting a side effect from the vaccine. So if
it's
you
only
look
the
at
side
it,
effects, right?
yeah. So if you look at it this way, you can kind of compare like the risk versus benefit of getting this vaccine. And also another thing I want to show is a lot of people have been worried about the blood clots. So I just want to show everyone the risk of getting the blood clot. So the risk of getting a blood clot from this AstraZeneca vaccine is actually 4 in 1 million. So only 4 people out of 1 million will get these blood clots. But if the risk of getting a blood clot, if you take the birth control pill, would be 500 or to 1,200 cases in 1 million women. In smoking, it's a lot higher. The chances of you getting a blood clot from smoking is 1,763 in a million smokers.
People doesn't afraid of the smoke. People doesn't afraid of the smoke.
And for COVID infection, it's so much higher than that. So if you're looking at the risk of you getting a blood clot, the risk of you getting a blood clot from all the other things that you do during the day, like smoking and stuff, you're a lot more at risk of getting a blood clot from smoking than you would from getting the vaccine. And if you decide not to take the vaccine and you do get infected by COVID, the chances of you getting a blood clot from COVID is so much higher than you getting a blood clot from the vaccine. So, I mean, it's all because the AstraZeneca vaccine is on a volunteer basis, right? So you can volunteer to take it or not. So it's all up to you. You need to, I've showed you some of the tables showing you what the risks are. So it's up to you now to decide whether you want to take it or not, and kind of compare the risk versus benefits of taking the vaccine or not taking the vaccine.
Yeah, after all, it's a volunteer basis. We show you the benefits and the side effects and the comparison. So you are the one who choose to get vaccine or not, right? So thank you, Doctor. Thank you very much. I think that's all the question that we have get from the comment box. So, and thank you for the talk. Thank you for the great talk. Thank you for the clear information. It was a pleasure to have you with us this morning. But before we end this talk, can you give the most important message, especially to our beloved student aged 10 to 12 years old, so that they can practice and share the awareness about this COVID-19 among them?
Yeah, so the most important thing for you to prevent yourself from getting COVID is like what I said. You need to be sure that you're wearing your mask properly at all times, washing your hands really, really good often, and making sure that you stay far away from a lot of people, and you make sure that you're always cleaning any of the surfaces that you always touch. So by doing all this, you're making sure that you won't get the COVID infection. And also, because all you students can't get the vaccine yet, your job is now to make sure that everybody else, all the adults in your family, get vaccinated, because if they get vaccinated, then you will be protected. Okay, so I hope that you guys can tell all your family and your friends about how a virus works and how it makes you sick, and also how a vaccine works and how a vaccine can help you.
Yeah, thank you, Doctor. So that's the message from the doctor to us. Students, please get your family to be vaccinated. Please ask them, because when we have the herd immunity, then you can be safe. Just in a simple way, you have to be the herd immunity first before the children get safe. Okay, nowadays the cases is among the children is quite rising, so it's very concern us every day, and we try to prevent it as much as we can. Okay, thank you very much, Dr. Ilia. So this concludes this talk. Thank you all for attending this live streaming. We hope you have learned and enjoyed this educational talk and have a good insight about these COVID-19 issues. Before we end, make sure everyone please fill in the attendance form using the attendance form using the link given by the Sifu Shams. Please fill in the link in the comment bar. Okay, so please don't forget to like, share, and subscribe this channel. Okay, stay tuned for another video after this. Please everyone, practice 3W, wash your hands, wear your mask, wash your distance, and try to avoid crowded space, confined spaces, and close conversation. Hashtag kita jaga kita. Thank you very much, everyone. Thank you, Dr. Ilia. So that's all for today. Thank you. Okay. See you again. Bye. Assalamualaikum.
Formal. Pertama sekali saya nak ucapkan penghargaan saya yang setinggi-tingginya pada frontliners yang telah saya tahu bekerja bertungkus lumus dan siang malam. Saya menyaksikan sendiri di mana-mana, di mana semua rakan-rakan yang ada di sini sebagai hero dan heroin kita orang telah membantu untuk menangani masalah yang paling besar yang tak pernah kita hadapi sebelum ni. Tak ada SOP, tak ada referral point, tak ada apa, iaitu masalah COVID.
Dan saya juga ambil kesempatan ini untuk mengucapkan terima kasih kepada semua kementerian dan menteri-menteri yang datang bersama untuk bekerjasama untuk melaksanakan MCO ni.